the dashboard. Dr. Velasquez will give the health officer update, and then we'll have Tiffany Turner, who is sitting in for Lindia this morning, as Lindia has also taken some time off. So Tiffany will give us an update on the general response, and then either Alicia, if she is on, or Carrie will give an update for GSI, and then we'll go to open discussion. And I think Arian might have an update on some isolation pieces there. So anyway, if we will go ahead and get started. Steve, if you want to kick us off with the dashboard.
All right. Good morning, everyone. So kind of the data theme this week is yellow light caution. But for the week of March 28th through April 3rd, there were 543 cases. There were 419 the previous week. That put our daily average up to 78, and the average last week was 60. Of those cases, 397 or 73% were confirmed, 141 were probable, and 5 were unassigned, so just 1%. The 2-week total, so March 21st through April 3rd, it was 962, 743 of those were confirmed. The prior 2-week total was 807. For age groups, it is vastly driven by the 20 to 29-year-olds, with 28% of all new cases being within that age group, another 14% for the 10 to 19-year-olds, and then 16% for the 30 to 39-year-olds. It drops off fairly significantly for all groups after that. Still keeping pretty great with the older age groups. For the 70 to 79-year-olds, there were only 13 new cases, 2%. 80 to 89, 7 new cases, 1%, 90 plus, just 3 new cases, which is good news. For the racial groups, with the new cases, 79% were for white, 9% were other or unknown, 4% Hispanic, less than 1% for the Pacific Islanders, 3% Black, 2% for American Indian or Alaska Native, and then 4% for Asian. So for our rate per 100,000, one of the phase goal metrics, for the past 2 weeks was at 187. It was at 157 last week. A lot of people have asked me in various calls and emails kind of what that translates to per day, or what our average should be. So to be just under that goal of 200 per 100,000 residents, we're looking for an average of about 73 per day, or 511 per week, 1,022 per 2 weeks. For new hospitalizations, we had 24 new Spokane County resident hospitalizations between March 28th and April 3rd. There were 16 the previous week. Again, with what that translates to meet our metric of less than 5 per 100,000 for 7 days, it's about 25 new hospitalizations per week that we're aiming for. 26 puts us just over the edge, or like 3 to 4 per day. Currently hospitalized in Spokane County, so this is Spokane residents and others, is 34 individuals. Unfortunately, we did have 4 new deaths last week, an individual in their 30s, an individual in their 60s, 1 individual in their 70s, and 1 individual in their 80s. There were 8 new deaths reported the previous week. For testing, our numbers are pretty high still. Between March 18th and March 24th, we conducted 6,210 molecular tests. The average number of individuals tested daily was at 887, which is a slight decrease from the really large number from March 11th to March 17th of 1,166. Our positivity rate did go up slightly to 5.2%, which is an increase from 4.2% the prior week. For healthcare system readiness, the number of staff beds available is 1,065, licensed beds 1,501. Total occupied census for staff beds is at 86.3%. For licensed beds is 61.5%. The total COVID census is down in general. For staff beds, it's at 3.2%, licensed beds 2.3%, and our total ICU census as of yesterday was at 83.3%, which is under that 90% cutoff we're looking for. There are no surge beds under use, and nobody is reporting any shortages. So for vaccination data, as of March 31st, we have given 224,769 total doses. That translates to about 26% of people in Spokane County initiating the vaccine, so 1 dose or more, or 134,119 individuals. And people fully vaccinated is up to 17.3%, which is great. For case and contact metrics, We investigated 486 cases last week and reached 66% within 24 hours. Our isolation facilities are still a resource for the community needing isolation services. The hotel facility census as of yesterday was at 8 or 22%, and the Immaculate Retreat census was at 23 or 38%. Our business technical advisors continue to serve the business community here. To date, so between May 27, 2020 and April 4th, 2021, they have done 6,719 consultations. They completed 115 between March 22nd to April 4th. And then for unemployment insurance claims, they've gone up just very slightly. So between March 21st and March 27th, there were 682 new claims for unemployment insurance. There were 666 the previous week. The industries impacted most were specialty trade contractors and food services and drinking places. And then to end on a final good note, we continue our great rate with outbreaks in long-term care. There were 0 new outbreaks reported in the previous week, so that remains 90 overall total. And there was 1 that was closed, so there are only 4 long-term care facilities considered in outbreak status. And that concludes my report. If there's any questions.
Any questions for Steve? All right, Dr. Velasquez for the health officer update.
Morning, everybody. Happy to be here today. And I don't know if you watched the game last night, but I still think it should be best out of 3. But that's just me. I would probably do that if I had the rules, because I bet you they'll have won the other 2. But this is just me. I do have to say, team has been playing amazingly, so we should be very proud. At the end of the day, only one team could win, and that is the way that is. But so Thane McCall and I were texting before the game, and I told him, it's my birthday, so you better win as a present to me. But he didn't text me after that. So, but I did tell him that I am very proud of the team, and I think they represent us well at a national level, and they have demonstrated why he said that they should always be considered one of the top teams in the nation, regardless. So, with that, I have a couple of things that I want to share with the group, and then I want to add a little bit of additional context to some of the numbers that Steve presented. So first of all, it's National Public Health Week. So thank you to all of you that have sent emails, etc. And as you may have seen on our website, the Spokane Symphony gifted all of the Spokane Regional Health District employees with access to the initial concert of the season, which happened last Friday. But they can access the concert pretty much anytime because it's streaming up in the cloud somewhere, whatever that may be. I don't really understand how that works, but I know it works. And for those of us that saw the concert, and Mary and I had the opportunity to do it virtually with James Slow, the conductor, it was awesome. The symphony has done a great job. The reason I bring that up is not only because of to thank the symphony for that generous gift to our employees, but also because one of the reasons why we're able to open the season has been because of the testing pilot that we've been running with the symphony that has allowed the musicians to rehearse in a safe way. And we've been doing that for several weeks. The musicians organization, musicians union was supportive of that approach, and it allowed really our musicians to feel confident that they could rehearse safely. But more importantly, I think it also promoted a behavior of care and caring outside of the rehearsal. Because if you know you're going to get tested and you have to rehearse, you tend to be a little bit more careful, which is what Brian Ritter, the general manager of the Folks, and Jeff himself, executive director of the symphony, were sharing with us. So we're very proud of that, and it's great that the symphony is able to release their virtual season. So that's number one. Second, we had our events and venues meeting yesterday, and I want to highlight a couple of things that I think are important for the group. We have created a live and evolving database of all events that we have information for Spokane County. And it's live on our website, but you need to be invited to participate. And the reason for that is because it's not accessible by all. It's only accessible to those that either have participated in the events and venues work group or need to have access to it. And if you have the opportunity, please go and check it out. Has everything by calendar, and that avoids conflicts of dates, because now everybody knows what all the dates are for everybody else. Makes it a little bit easier. Has all the documents that have been provided, all the presentations, all the meeting notes, as well as direct access to all the live links that you need to have as you plan. So it's like one-stop shopping for anything that has to do with any type of event that for which we have guidance thus far. So I do want to say thank you to the team here that put that together. We're actually thinking of creating a few of those models for other things that will provide those that need to participate in specific activities, like a one site that they have access to where everything is there and you don't have to go and search in more than one place, because it makes it easier for all. Now, the only thing that out of respect for those that have submitted information, it cannot be edited, meaning we don't want someone by accident to erase an event or change the date or change the name or put a typo somewhere that would make it look terrible. So in addition to that, we had Karine Heenan, who's the executive director of the Washington Arts Commission, joined the work group yesterday and gave us an update on the draft guidance for events in arts and culture that goes beyond that, because it also includes things like parades. So the endpoint is by later this week, we do hope to have additional guidance for some of these events, including parades coming out of Department of Health and the Office of the Governor. So she's going to keep us posted on that. So we have now direct link to that commission, so we can update the team, the local team here in Spokane, as to what the guidance is and what the thought process around the guidance is, so we can provide some feedback. So I think that work group is working really, really, really well. The membership continues to increase. There are others that have requested to be part of it, so we're very happy for that. And we continue working on the theory that at some point, some activities will be available to us. So I wanted to give you a quick update on that. And then we're going to talk a little bit about the trends. And I think, as Steve mentioned, we're at a little bit of a tipping point here, and we have to be careful going forward. So we're coming out of Easter, we're coming out of the NCAA, we're coming out of spring, well, coming and going into spring break, depending on what age group or what school you're at, all of which are times in which we do see more celebration, more people getting together. And although there are guidelines for how to do that safely, and they're on our website, by the way, you can go and check them out, how to celebrate spring break, how to celebrate Easter, and we'll continue putting out guidance as much as we can. We do have seen an increase in some very specific age groups, as Steve mentioned. Actually, if you take the 20 to 49, that's over 65% of all cases. And although many of those will not require acute care and or hospitalization, the more people that are infected, the more likely that you will end up transmitting to someone that may require hospitalization and other type of care, which is what really impacts that hospitalization rate that we're seeing. Of particular concern is the 2029, specifically the 18 to 23, where we're seeing these spikes. So we've been working very closely with our higher education institutions, not because the cases are necessarily at the higher education institutions, although we've seen a couple of outbreaks there, but because they're in the age group that tends to be either in or around higher education institutions. You know, your friends, you may not be in college, but your friends are, so on and so forth. And we have actually had conversations also with some of the establishments around those campuses to make sure that they have the most updated guidance, and if they have any need for additional support or additional information or additional PPE, that we're there with them. So we're very proactively contacting and having a conversation on behalf of the community. But the reality of the matter is that the numbers have gone up and continue to go up. And actually, if you look at the histogram we have in our website, we are a point that resembles what we saw late September, early October, right before that November through January surge. So that's what I'm saying. We're like a tipping point. Now, the biggest variables right now that we did not have as much of at that point was, one, vaccines. So pushing to get as many people immunized as we can is very, very important. This is, vaccines versus virus right now. And my goal is that the vaccines win. But we got to keep moving forward with that. I do want to say thank you to our healthcare partners and others. I know everybody's trying to get as many people immunized as they can, and we're going to have to continue doing that as quickly as we can. The good news is that if you look at the numbers, that group with potential for high morbidity, hospitalization, intensive care unit, including mortality, 60, 65 and beyond, has remained low and kind of steady. And we did immunize the significant percentage of that. Right now, the Spokane Regional Health District is working with a number of organizations, everything from Meals on Wheels to Visiting Nurses Association, working on homebound individuals, many of whom tend to be elderly and have other either disabilities or restrictions, etc. So that's one of the high-risk work groups, high-risk groups that we're working on right now. So the second variable that we didn't have before, the variants. And as you know, the number of variants continues to increase, particularly the variant 1429 from quote-unquote identified earlier in Orange County seems to be becoming the predominant one. And although it may not have the same transmission characteristics of the UK or the South African or the Brazilian variant, it's still worrisome because it's really good at getting into people and staying. It has very specific mutations that allow it to, once it connects with the cell receptor, to make a very strong connection. And that's all they need to transfer genetic material and take over the cells. So that's why those have been associated with surges in various parts of the world, starting in the UK. We've seen it all over the world. We saw it in California also. So we have to be mindful of that. If you want any additional information on the variants, there was an opinion op-ed this Sunday on the Spokesman, and on our website there is an article, a review on all the variants. You just have to go to Spokane Regional Health District.org. I always get the letters confused. srht.org, and you will see it in one of the options to look at. So take a look at that, because it explains a lot about why is it that is important. And at the end of the day, the basic issue is that the more that we open the economy, which is something that of course we want to do, the more likely that we'll have more people out, particularly those age groups that are more socially mobile. And if you have variants, all they need is one person to infect 10. So just, that's why we're being so cautious about it. So I think the point is variants or wild type virus, the transmission is the same, person to person. So as we've said before, being really mindful of public health guidance is now probably more important than ever, because we have vaccines. We have made a lot of progress. We need to protect that progress that we've made. But we've deployed as much in testing and vaccines as we have access to. And one of the testing modalities that we've been following, and although you don't have that, we do track it through our testing team, is the antigen testing that we're using. And we saw the positivity start to go up right about the first week in March, and continues to go up, which basically tells me that we are seeing a lot more positive cases that at some point will end up contributing either to the molecular testing positivity rate and or hospitalization rate. So we have to be mindful of that. And I think is a good time to remember a couple of things. First of all, I think everybody's tried really hard for over a year. So we have to acknowledge that, including our college students, because imagine being a college student with all the current restrictions that we have. I mean, it's tough. The same for the elderly, the same for those that have families. That means we all have been impacted in some way, shape, or fashion by the restrictions that have been imposed because of safety and transmission. So I do want to acknowledge that because I think it's important that we remember that. But it's also important to remember that we still have a little bit to go. So now is not the time to let the guard down. Now is the time to step it up a notch and make sure that the variants will take hold in the community before vaccines can do their thing. And as you know, we're opening to all as of April the 15th, which is only 9 days away. And as of the 31st, we have a large segment of the population that is eligible. So I do encourage all to get immunized if you do qualify. And after the 15th, please, as many people as we can. I'm happy to say, and I'm sure Tiffany will talk about this, but we did see an increase on the allocation of vaccine coming this way, meaning to Washington State over the next week or so. So that's very encouraging. And I think we need to work on that. On the 12th, there will be the report out of where counties are at in terms of the roadmap to recovery. So we're keeping our fingers crossed. But as Steve mentioned, if we go over like 73 a day or so, it starts to get complicated for us to hit or to miss one of the two metrics, either the rate per 100,000 or the hospitalization. And I have to tell you, the 200 per 100,000, that was my recommendation to the group when we were looking at this. And a lot of people were thought it was high, and maybe a little bit higher than where CDC talks about various levels, but I thought it was reasonable given the picture we've seen on this pandemic in the state of Washington. So, and in some communities where being under 100 is just going to be very difficult, particularly college towns and so on and so forth. It's just going to be hard to do. So let's work on that. Let's try to do as much as we can. We will continue doing as much as we can. We're working with our higher education institutions, including not only testing, but looking at potential for immunizations and so on and so forth. So we'll keep doing that. We'll do as much as we can. But we all have to do a little bit of it. It's not just what we can do, it's just what we all can do. And I do have confidence that we'll step it up a notch and we'll keep moving forward because we've made a lot of gains and we certainly don't want to go backwards. And if we do, we'll come back. There's no question in my mind. So with that, I want to stop here and see if anybody has any questions for me.
Well, Dr. V, I'll just say that I'm glad you're addressing the issue with the cases because we were doing a really good job and now things have started to tick up a little bit. I was contacted by leaders in hospitality and entertainment industries about rumors that they're hearing that we will go back to phase 1 on April 12th, and I'm not sure. And I know that's the next phase where we're going to be looked at, where metrics will be looked at. We try to confirm that rumor, but I know that there is some concern with the governor's office, especially cases on the west side are higher than they are here. And, whether any rollback might be regional, by county, or statewide. So just know that there's a lot of I'll just say concern here from people who are worried about another rollback.
Thank you, Mayor. And yeah, I agree. We share that concern. And if you look at the trend for the last year plus, the west side, particularly 3 counties, tend to be between 14 and 21 days ahead of us in terms of the trends. And although we kind of buckled that one a little bit as we were coming out of the holidays, the Christmas and so on and so forth, we didn't spike as much as other areas did. Now we're kind of trending in that direction. That's why I say it's time to like pull it back as much as we can. And I do know that we have some work to do, and I am still hopeful that we can pull it back. But if we're not able to, just because of the timing, then we'll have to work on getting it back where it needs to be. And that's going to require a lot of work that we've done before. We can do it again. I would just prefer not to have to do it because that means we have to pull back first. But let's stay focused on it. Let's spread the word. We're using as many avenues as we have access to spread the word. I know that the college presidents have had conversations with their students. I know that everybody's trying, I'm not just speaking about students, I'm not focusing just on students, but just to give you an example, in businesses, please, same, be mindful, be careful, and all of us, we need just to be careful with where we're at right now. So, thank you, Mayor. Any other questions? I don't see any other questions, Ray, so thank you.
All right, if anybody has any questions, we can address those at the end too. So, all right, next up is our general response updates by Tiffany. Tiffany, go ahead.
Good morning. Dr. V gave a great summary of a lot of the activities that have been happening, and we heard from Steve about the cases. The only thing I wanted to add around cases and investigation and such is our epidemiologists are really keeping also a close eye on some breakthrough cases that we've seen. So there have been about 20 identified cases of that are breakthrough, which means cases in those people that have been fully vaccinated. And so our epidemiologists are working closely with Department of Health in investigating those individual breakthrough cases. And as well as, like Dr. V had talked about, keeping an eye on those variants. We've identified about 3 different variants within Spokane County, about 15 plus cases of those variants. Sorry. And then as far as on the vaccine front, lots of vaccine flowing through right now, as Dr. V had mentioned, particularly the Johnson & Johnson, we are starting to utilize because that is a 1-dose vaccine. We're using those for some of those harder to reach populations. So we're working closely with Aging Long-Term Care of Eastern Washington. They've provided a list for us of those people that are homebound and actually helping assist us in calling those people to identify if they've been able to access vaccine or if we need to send out teams to be able to go into their homes and vaccinate if they're not able to get out and access. We're also working closely with the Spokane Fire Cares team to also reach some of their homebound and higher risk populations that they serve. So that's a great partnership going on right now. We're also in partnership with many of the different fire stations, particularly those in the rural areas, to increase access for those people that living in the outer edges of our county population. And then, of course, still working with many of the different cultural groups to provide vaccine clinics within their communities. As mentioned, too, with the increase in the college-age population, we are working with a couple of the different universities here in town and coordinating with them to set up vaccination clinics on their campuses to both vaccinate those living on campus and those living off campus. So hopefully we can put a dent in that population as far as increasing those vaccination rates. Also doing some work with businesses. Specifically, as SRHD's role is primarily that safety net vaccine provider, and so trying to identify those businesses that are most at risk or having the highest risk factors as far as, if they have a large population of workers that are disproportionately impacted, or those workers that might have some of those shifts that are more difficult for them to get access to vaccinations, trying to work with those businesses to make sure we either work with a contractor to get them into that business to provide vaccinations, or referring them to the different pharmacies that are located near them. DOH has also put out a business vaccination toolkit that also takes businesses through a step-by-step process to ensure that their employees can get vaccinated. And so we just encourage you, SRHD, we've distributed over 18,500 vaccinations with our partners, and just encouraging you all to, keep an eye out for any gaps that you may have seen or heard of, and get that information back to us so we can make sure and try and address some of those gaps that we might be seeing in our community. Just a couple last things. The governor, it sounds like he's going to be here on Friday touring our mass vaccination site that we have at the arena. So there'll be a couple of us going over to join him in that tour. And then just kind of the last thing that we're doing as an agency is really having some discussions around right-sizing this response structure, being cautious because we are seeing an uptick and a potential fourth wave that might be coming in, but also trying to be cognizant of the resources that we're devoting to this response. So it's kind of a delicate balancing act to try and, balance how many staff or contracts we have, but those conversations continue to happen. That's pretty much it for my updates.
Any questions for Tiffany? All right, hearing none. I don't know if Alicia or Carrie are on from GSI, that we've got a caller. I'm not sure who that is.
Actually, Ray, Alicia and Kara, they're both on spring break. They emailed me a little bit while we were on the meeting that they're not going to be able to join us today. So I'll call Alicia later today and talk some of the things we just went over. And I think her biggest question was what we discussed earlier about the trends. So I'm going to update her later on today.
Okay. So Arian, I don't know, we'll go to open discussion. Arian, did you want to touch on the conversation that you and Joe had?
Yes, excuse me. Yes, absolutely. And Joe is here with us for a few more minutes. Thanks to Sarah at the city and Carrie Griddle at the county. We've talked, and I think we have decided that really trying to fold in some new populations under a COVID response really isn't in anybody's best interest due to the level of paperwork involved in working with FEMA, that it is a reimbursement only situation that would require both the city and the county to front quite a bit of the cost ongoing. However, we did realize that the population that Family of Promise is working with is one that does need attention and provisioning, not only within the COVID situation, but ongoing. And so since Joe's here, I'll kind of let him share a little bit about those two populations, families that have infants that are find themselves homeless, and then families that have individuals with acute medical risk that find themselves homeless. And then just as a side note, we will continue to work with Joe on some other more sustainable funding options, primarily through our Accountable Community of Health, which is Better Health Together, our Behavioral Health Administrative Service Office, which is hosted through Spokane County, as well as introductions to the managed care organizations that should be able to work with Family of Promise for direct funding above and beyond what's going on with COVID. So Joe, like to introduce you to the group.
All right. Good morning, everybody. My name is Joe Ader. I'm the Executive Director of Family Promises Spokane. I know several of you already. But yeah, we work with families that are experiencing homelessness. And so most of the time when people think about homelessness, they're not thinking about kids. But our niche is working with families with children. And so we are the last resort. So we are the emergency shelter for families that are experiencing homelessness in Spokane County. So any family that experiences homelessness can walk in our doors 24 hours a day, 7 days a week. The trends that we've been noticing and that we've been tracking for a while now is that our largest single age demographic that we serve is under 1 year old. That's our largest population. That's 6% of our family homelessness is babies, infants. And so 3 years ago, it was recognized by the city that that population isn't right to be in an emergency shelter, a mass shelter with lots of people and lots of germs, because babies can't be immunized to anything until they're at least 4 months old. And so they're very health at risk to all kinds of different medical issues. But we are the best last resort, basically. And so we see a lot of infants. Currently, though, with COVID, we are seeing a baby boom. So we have 5 newborns in the shelter right now, including a preemie that is 2 months old and only weighs 5 pounds. And then we have 3 pregnant mothers currently in shelter. And so we had it on our 3-year plan to actively pursue and open a shelter for families with newborns specifically that would have independent rooms for each of those families. And we have sped up that process to where we are trying to open one by May or at some point in the next month. We have been actively pursuing annual funding for that. It's going to take about $220,000, $229,000 a year. We have raised $70,000 of that so far. So we have $159,000 left on annual funding. And my board requires annual funding secured before they open a new program. So that's what we're trying to raise the next month, $159,000 for that. And then the other one is families that are exiting the hospital after a medical issue or that have children that are in some type of chemo treatment. We also have those families in the shelter in the same situation. They're just susceptible to all kinds of germs and illnesses. And so we have raised $100,000 towards that project, which will cost $188,000. So we have $88,000 left on that. And Providence, I got to give Providence credit. They have come in with $150,000 towards these 2 projects and are trying to help us get those open. And then another $20,000 from Rudine. I actually have to leave in 2 minutes because Numerica is also going to be presenting a check towards the infant shelter this morning, and we're not sure what that amount will be. So, but right now we're looking at $159,000 left to raise there, and $88,000 on the family respite, which is $247,000 total needed for annual operations to open up those 2 new shelters with new capacity in the next month. Any questions there? Okay.
All right. Thanks, Joe, for the update. If we have any questions, try and direct those towards probably Arian or Joe. We can try and get those answers. So,
And Ray, one thing, I just wanted to confirm that this topic, does the group want to kind of move it out of this group since it is a COVID recovery focus and on to more long-term health and human services groups? This was going to end the agenda item here, but I wanted confirmation that we supplied an answer related to the FEMA isolation grant and that we can then bring it on. There's a number of other regional leadership groups focusing on these things. So just wanted to make sure it was okay to drop this off the agenda. I'm seeing some nods, so, yeah. Okay. We will undergird this topic in some other areas, and thank you for the time to take a look at it.
Yeah, thanks, Arian, for the update on that. Thanks, Joe, for helping us out here. So, all right, any other questions that we have for the group? Dr. V, anybody? All right, seeing none. So our next meeting, at the last meeting, it was decided that after today, we would go to an every other week. So our next meeting will actually be 2 weeks from today, April 20th. So if you can put that on your calendar, Ann will be sending an update for that, when she sends the minutes and that out. So if there is nothing else, again, just to reiterate what Dr. V mentioned at the beginning, that this is National Public Health Week. So keep an eye out for that. If you see public health individuals, thank them, pat them on the back. They're doing great work. And then Kelly's also going to be pushing some stuff out through via social media, and you might be seeing some stuff on the news. We're featuring a different topic each day this week. So again, thanks to everybody here at the Health District that has worked so hard, and the other activities that we do on a daily basis that kind of have seemed to fall by the wayside through this, at least in the public's eyes. So thanks, everybody. And if there is nothing else, have a great day, everybody, and we'll see you in 2 weeks.
All right, everybody. Thank you, Ray.